All right, thank you very much. Please enjoy your lunch as I'm presenting this case. I was trying to find, we're a referral center, so I'm trying to find a relatively straightforward case. This case is to kind of illustrate several points about workup and evaluation, hopefully in some ways to bridge from yesterday to today to even tomorrow as we go through course of a patient here. So this patient is a 56-year-old male. He's right-handed and had an onset of seizures at about 9 or 10 years old, so relatively early on. He was having about 3 auras per week. The auras, as you probably know from patients, we talk about auras, and I think we think that when we hear the word aura as a neurologist, as a physician, we kind of think of, oh, this is a feeling that the patient has, but they really kind of go along their daily routine. Although when you do actually ask a lot of patients, sometimes they use this term aura as a small seizure, where it actually does interfere with their life. And so whenever they say aura, I like to always clarify that a bit. This patient did have these auras that were a bit more than the typical funny feeling. They actually were more consistent with the semiology as listed here below, where he has a funny feeling. And I think it was mentioned yesterday by Dr. Burkholder that the patients a lot of times with seizures do not have a very good way of explaining this feeling. And that might actually be one of these defining characteristics between a syncopal event or a seizure event. But it did involve blinking, lip smacking, eye deviation to the left, and then about 4 times a year it can have bilateral to focal to bilateral tonic-clonic activity, right? He does also have a deja vu sensation with epigastric rising. This was prominent younger, but that was a prominent feature and had been. So this gentleman for many decades has suffered with this throughout his life. He came to me on quite a large dose of Oxtellar XR,